So today's topic is Cryptorchidism. So definition is it is bilateral undescended testis. It came from a Greek word meaning hidden testis. It's a common disorder identified at birth. So what do you mean by this maldescended testis? Maldescended testis means testis that has not reached the scrotum. In that comes undescended testis, retractile testis and ectopic testis. Undescended testis, it contributes to 35% of the newborn, and retractile testis is seen in 60% of the newborn and ectopic testis in 3% of the newborn. In what are the difference between the undescended testis, retractile and ectopic testis? Undescended testis means testis developed in the loin region and it descends down to reach the scrotum. So the pathway is from the abdomen, it reaches the internal ring, then through the inguinal canal it reaches the external ring, from there to the root of to the scrotum. So in that case, at any place this descent can be arrested. So in that case we will call it as undescended testis. So in a case of undescended testis, you will find out testis in the normal path of descent. That means maybe in the abdominal cavity, maybe at the site of internal ring, or maybe at the inguinal canal, in the inguinal canal, or outside the inguinal canal at the external ring. And in that case the scrotum is underdeveloped. That means the rugosity of the scrotum will be absent in this case since it hasn't reached the scrotum. So that is a case of undescended testis. Then what is ectopic testis? So ectopic testis means it has developed in the abdominal, the testis has developed in the abdomen and it has reached up to the external ring. But after that it is not directed to the scrotum. From there it is ectopically pulled to other sides. It can be in the lower abdomen, or it can be at the root of penis, or it can be in the perineum, or it can be in the femoral triangle. So these are the sites where you see ectopic testis. So ectopic testis is the testicular tissue seen other than the normal path of descent. So that is ectopic testis. So what is retractile testis? So here also the testis developed in the normal way, and at the time of birth the testis reaches the bottom of scrotum also, but because of strong cremasteric reflex the testis is pulled upwards to retain in the external ring. So that is called the retractile testis. But in this case the testis is the scrotum is fully developed. When you see the scrotal skin, you can see the rugosities on both sides, but the testis is absent. So in that case you can confirm that it's a case of retractile testis. But testis not present and the scrotum is also not well developed. That means it may be a case of undescended testis or ectopic testis. So coming to undescended testis, the kidney develops normally in the iliac region and it ascends upwards to reach the loin. But in case of testis, it develops in the loin region and it descends during intrauterine life. So what is the definition of undescended testis? I have already told you. Testis seen along the path of descent. You know the path of descent. Bilateral undescended testis is called Cryptorchidism. Descent of testis has two distinct phases. One is trans-abdominal phase and inguinal phase. Up to 7 months of intrauterine life, the testis remains in the abdominal cavity. During the 7 to 9 months of intrauterine life, it reaches in the inguinal region, that is the inguinal phase. After that it reaches the scrotum. Cryptorchidism, it is usually associated with Klinefelter syndrome, prune belly syndrome, renal agenesis, bladder extrophy, horseshoe kidney, anorectal malformations. All these are developmental anomalies. Coming to the etiology of why this cryptorchidism occurs, that may be due to deficiency of the androgen or human chorionic gonadotropin, that is HCG, gubernaculum dysfunction, because normally gubernaculum from the bottom of the scrotum, it is attached to the testis. It contracts to direct the testis into the scrotum. Maybe this gubernaculum is weak or dysfunction. Maybe because of that, the testis is not directed to the scrotum. Prematurity of the baby, familial, seen in families also, in diabetic and obese mother, alcohol and smoking in pregnancy, and there is one more reason, that is lack of calcitonin gene related peptide, which is produced by genitofemoral nerve, which is the main factor for the descent of testis. Lack of this CGRP, that leads to cryptorchidism. Then what is the incidence of cryptorchidism? If it is a premature infant, there is 30% chance of occurring this defect. Full term, 4% of the full term infant also shows cryptorchidism. Normally 50% right side testis is affected, and in 30% cases left testis alone, undescended testis is seen, and both testis in 20% of the cases. So what are the different positions where you see undescended testis? In the abdomen, just above the internal ring, or in the inguinal canal, or in the superficial inguinal pouch, that means in the external ring region. The clinical presentation, what will be the clinical presentations when a patient comes with, when a mother bring a child with undescended testis? This is absence of testis, maybe on one side or bilaterally. The scrotum will be empty, and sometimes a patient present comes with a swelling in the inguinal region. So on examination, the scrotum will be empty, underdeveloped scrotum, that means the rugosity will be absent. So that means it's a case of ectopic or a undescended testis. On examination, you can see sometimes if it is in the inguinal region, you can palpate a swelling in the inguinal canal. Try to manipulate it down to pull the testis to the bottom of scrotum. If possible, it is retractile testis. In ectopic testis, it is not possible. In undescended also, if it is high up, it is not possible to bring the testis down to scrotum. So you can do, in that child coming with empty scrotum, you can make the patient do a leg rising test, that is swelling more prominent in a case of ectopic testis, as it lies between the external oblique and the fascia scarpa. So that time with the muscle, while doing the leg rising test, the muscle become taut and this swelling become more prominent. This testis become more prominent if it is an ectopic testis. But in a case of undescended testis, the swelling become less prominent as it lies deep to the external oblique muscle. Then what all investigations you do to confirm your diagnosis and to find out where is the testis? Ultrasound abdomen is the best investigation. CT and MRI not advisable. If abdominal testis suspected, it is better to go for a diagnostic laparoscopy, by which you can diagnose the position of testis, and at the same time you can do surgery also. Because nowadays laparoscopic assisted orchidopexy is the best technique. So while planning for the laparoscopy, you can plan the surgery also. What all will be the findings in laparoscopy in a case of undescended testis? If cord structure seen in deep ring, that means testis is in the inguinal canal. because while doing laparoscopy, you can see the cord structures coming. Vas deferens from the bladder side medially going to the internal ring. Testicular vessels and testicular vessels and the paminiform plexus coming from the laterally, and it is going to the internal ring, and it form the cord structures, and it goes to the scrotum. So if you can see that cord structures in the deep ring, that means the testis is in the inguinal canal. If no cord structures seen in the deep ring, that means testis is in the abdomen. So you have to find out from loin to internal ring, you find out the testicular tissue. Then a blind ending vas, if you see in the abdomen, that means the testicular agenesis or vanishing testis. So what do you mean by vanishing testis? That means normally developed testis in the intrauterine life, but due to some vascular accidents happening in the intrauterine life, the blood supply to the testis is lost and the testis atrophies. That is called vanishing testis. So in that time you can see only the vas only, no structure at the end of the vas. So that is a blind ending vas. If you see, that means it is a testicular agenesis or a vanishing, that denotes a vanishing testis. Then what treatment you give if you diagnose a case of undescended testis? So what you can do is an orchidopexy, or it can be named as orchiopexy also. So ideal time for surgery is any time after 18 months. Usually we advisable to do it after 2 to 4 years time. The principle of surgery. So cord is very short and the testis is placed in the inguinal canal. So it is very tight to bring the cord testis to the scrotum. So the principle of surgery is good mobilization of the spermatic cord. And along with, you can see inguinal hernia also, hernial sac also. So repair of the hernia, and after that you bring down the testis and fix it to the scrotum without any tension. If it is in tension, it will lose its blood supply and it will go for atrophy of the testis. So without tension, you have to bring down the testis to the bottom of scrotum. So sometimes it may not be possible if it is a short spermatic cord. It is very difficult to bring it at first surgery to the bottom of scrotum. So that time we will do the surgery in 2-stage operation. In the first stage, mobilization of the cord in the first stage, and in the second stage of the surgery, after 6 months we do after second stage. First stage we will mobilize it till the inguinal canal, and after 6 months you mobilize the testis from there to the scrotum. So complications what can occur if it is a case of undescended testis. This is testicular atrophy, repeated trauma, hematoma formation, torsion can occur if it is in the abdomen, infertility because of the high temperature in the abdomen, the spermatic production is decreased and it leads to subfertility or infertility. Then association of inguinal hernia, then malignancy reported in undescended testis also, because the heat is very high in the abdominal cavity. So 40% chance of malignancy, especially in abdominal testis. The what type of malignancy you see is seminoma. Though there are some name of surgeries which is mentioned here. So that is for you may not need all these things, but you can just Omredani's procedure, Dennis Brown's procedure. If you are interested, you can go through these procedures, what we are doing for that. The idea of surgery is mobilization of the cord and fixing it to the bottom of scrotum as one time procedure or a 2-stage operation. Then what we do in Silbar procedure is you cut the testis with its blood supply and auto transplantation in the scrotum. with microvascular anastomosis of testicular vessels to the inferior epigastric vessels. So at that time there is no need of any tension or traction or something like that. So auto transplant, you from the abdominal cavity you take out the testis along with its blood supply and the vas deferens, and you implant it in the scrotum, and microvascular anastomosis and the vas and vas you can anastomose it. So the blood supply is maintained by doing microvascular anastomosis. Then laparoscopic assisted orchidopexy, that is the accepted method that I have already told you, that for diagnostic lab, while doing a diagnostic lab itself you can plan for the laparoscopic surgery. Then there are some role of hormone treatment for the undescended testis, because there may be some deficiency of HCG for this boy. At that time only the hormone treatment is given if the patient hasn't undergone surgery till the age of 4 years. Then you can wait for 8 years and you can give HCG injection, that is 1000 IM twice weekly for 4 weeks you can give. Don't give it more than that. And sometimes you can use nasal spray, gonadotropin releasing hormone nasal spray 1.2 mg per spray daily for 4 weeks. Don't try this on ectopic testis, because ectopic testis is placed in an abnormal path, so it cannot direct it to the scrotum. So in that case hormone treatment is not advisable in ectopic testis, but it is advisable rarely in certain cases of undescended testis and retractile testis. So one word about ectopic testis. The descent of testis occurs normally till the external ring. After that, it is diverted to an aberrant position. What is the etiology? There is a theory called Lockwood theory. There are 5 tails of gubernaculum testis. Gubernaculum, that is scrotal tail, pubic tail, perineal tail, femoral tail, and superficial inguinal tail. So there are 5 tails of gubernaculum testis, but scrotal tail is very strong. That is why the testis is directed towards the scrotum. When the scrotal tail is weak or it ruptures due to some reason, the testis is directed to ectopic positions. So that time the pubic tail or perineal tail or femoral tail, which one is strong, that will take the testis to their position. So that is why the ectopic positions we get is the superficial inguinal pouch or the Dennis Brown pouch, perineum, the root of penis, or in the thigh in the femoral triangle. So these are the positions where you get ectopic testis. So retractile testis. So word about retractile testis. Testis and scrotum normally developed, but due to overaction of the cremasteric muscle, it pulls the testis up. It can be pulled down by manipulation or by or chair test. What is or chair test means? You make the patient or the child sit with the thighs and the knees flexed in a chair. So while doing this procedure, the abdomen is pressed and the testis which is pulled up will be pushed down. So that is called or chair test. In that case, there is no need of surgery. You can try a hormone treatment. It's a normal developed, since it is a normal developed testis, there is no problem for the child. So this is the thing about undescended testis, ectopic testis and retractile testis. These are the mal-descended testis. Cryptorchidism means it is undescended testis occurs bilaterally, that is called cryptorchidism. The surgery we do is orchidopexy. Okay.